Today we're going to be talking about the intersection between public health and civic identity. Civic identity is the sense of we are as members of a shared society. It's how we see ourselves in relation to our communities. It's about understanding that sometimes it's about a social contract. We have the right to receive, but sometimes we have obligations as well to give back to our community. Public health, on the other hand, is very misunderstood. It's not just about hospitals, diseases, it's about everything that surrounds us. It's the water you drink, it's the air you breathe, it's the food on your shelves, the safety of your streets, and sometimes it's the policies that protect you and also the systems that fail you. Now, how these two ideas are connected is and remains on one simple question that we need to ask ourselves. It's how does our civic engagement or lack of it impact the health of the places where we live? So without further ado, I'm now gonna go to Dr. Tamar Kabakyan to ask her about her expertise in public health and get some insight on the topic. Given your big background in public health and your expertise, how do you think it connects to being an active citizen in a way?
In the core of public health, you have citizenship because it directly is related to the values that we stand for in public health. Equity, social justice, and all of these you need as a public health professional to consider and to make a difference in every time you are acting to promote the health of the people. So as a public health professional, you have to fulfill that role for more equitable life, quality of life, and health for everyone, and social justice. And you have to also work towards creating systems where people can promote their own health. So this is what we stand for in health promotion. And in health communication, we also work with the people to actually make sure that they can have all the skills and have all the necessary resources to be able to promote their own health. So this is very closely linked to the civic responsibilities and the citizenship values that we look forward in any population.
What role do you think citizens play in maintaining or improving public health in the sense of maybe vaccination campaigns or policies that are placed? How do they play a role in helping these policies to be a success or to fail?
We have the responsibility, when I say we, everyone who is in charge of any program or working in any capacity, whether in the public or the private sector, to create systems for people to be able to engage in, policy development, creating opportunities for people to, through policy dialogues, through participatory approaches, where we get to allow, or rather than allow, actually give space for all the constituents in the population to be able to participate in policy making. Now, when we think of policies that affect health, they're not necessarily related only to policies that you would see created at the level of the Ministry of Public Health or things closely related to health, but you can also be contributing to policies related to education, to policies related to transportation, to labor law, etc., because all of these aspects actually influence the health of the population. Road safety, civic laws that provide, for example, women's rights in a country, they all trickle down into providing better health to your population. So in the core of that policy making and health in all policies, you also want your population or your groups, different constituents of the population, to be participating in policy making. So this is also an important role for health communication specialists, specifically within the public health disciplines, where they can actually work in advocacy, where they can do a lot of campaigns, where they can do a lot of community development and engagement activities through communication and all the other aspects that they are competent in and have expertise, to be able to create those spaces and mechanisms and systems so that people participate in policy making in an equitable way. And that will definitely improve social justice and improve even the implementation and the enforcement of these policies down the line, because then people will feel that they own these policies because they were part in making them.
How does misinformation or lack of trust in public health institutions affect civic engagement and health initiatives? Because, as we know, trust is one of the big kind of aspects of creating a campaign or making policies to change policies. How do you think the lack of trust in the governments, the institutions in the last 5 years has affected this, and what could we do or what could citizens do to kind of get over this big wall?
Exactly like you said, Leonie, trust is very important in maintaining but also making sure that the population or communities are participating but also benefiting from every kind of health program or a service that is being given, and that is in the core of everything we do. And as you mentioned, it is an essential concept that you would see in all of your health communication activities. So how would you build the trust? You have to start in small increments. I think also as citizens we cannot just wait for things to get fixed and then say, now I trust the government and I want to be engaged. But also, as people working in the public health area, we have the responsibility to create trust through engaging with the community and being transparent in our engagement. So you create those certain, let's say, small bubbles of trust through different activities and programs that you are doing, and that will be something that builds on each other. But everyone who is working on those programs, and in all of the programs, people need to actually uphold the same principles of transparency, accountability, and participatory approaches for the communities to be able to actually make sure that their voices are heard, that their opinions and their inputs and their feedback are taken into consideration in program development and implementation. So yes, I mean, it's very difficult, but it is essential, and it's in the core of everything we do in health communication. Therefore, there needs to be a lot of effort, especially in groups and communities and populations at large, such as you mentioned in Lebanon, where there is distrust in the system and in governments in general. So saying that also does not negate that in everything we do, we need to build small bubbles of trust through accountability and transparency, and it will come in increments. But it will take time. It might take years. It might take a generation or more, but it needs to start somewhere, and it is in the core responsibilities of public health professionals.
As public health challenges continue to evolve, how can citizens remain engaged and take responsibilities for improving public health in their communities?
Going back to the same notion that public health exists in everything we do around us. So in any volunteering activity, when you are contributing to the improvement of life, to the quality of life, or even to specific tasks such as improving the quality of education or improving safety, etc., you will be down the line contributing to improving the health of the population. Remember, health is not only the physical, absence of physical diseases. It's all about social health, psychological health, emotional health, and building on the resources that we already have, as you said, as youth, volunteering and engaging wherever we can, wherever it's feasible around us in our communities. It's important to probably make it visible in different communities, in different groups, how we can impact the health of the population down the line, and showing how things are linked. This comprehensive way of looking at the health of people. This is what would make public health visible for people and understanding what public health is. So if you're contributing to community activities in a village, let's say a fair care or anything, even for entertainment, that will contribute to the social life of the village. And that is something you can use to, during your campaigns, during anything you would want to do to improve the health and promote health of the population in that village. So you need to see the engagement and the volunteerism in all aspects of life related to outcomes in health. And this is what actually makes public health so encompassing and so like a big umbrella that encompasses a lot of different aspects of life.
Thank you so much.
Thank you, Liana.